Oh man, well, yeah, just real quick, me and Tom and I know each other, but Albert Chester, born and raised in Jacksonville, Florida, graduate of Episcopal High School as well as Florida A&M. Played football there. Worked as a pharmacist at Walgreens for a few years, well, about 8 9 years. Started a pharmacy technician program, the Capstone Institute. Had some great stories. Was able to pretty much all my students were for free. Because maybe so like 98% actually went for free, so that was major. Had some great success with the school. Parlayed that into open up a pharmacy, Newtown Pharmacy. Did free home delivery, free blood sugar testing, blood pressure testing, and during that time, just really got intimate and more in depth with not just my patients, but the real issue of healthcare. And it really, I mean, from a personal standpoint, kind of traumatized me, but just from a practitioner standpoint, made me want to do more and really solve the problem. And you hear so many people talking about universal health care, or Medicare for all, or the current system we have, or this and that, private insurance, public options, and all that stuff. But what does it really mean, and what's really the most effective way to make sure everybody has health care? Because I mean, we made some good strides, but a lot of that was pushed back. But at the same time, you got close to 30 million Americans that don't have insurance, and the ones that do have it, I mean, are almost scared to get sick or go to the doctor, because of the unknown of the co-pays, of the prescription drug costs. It was a lot, and reached out to federal as well as state and local legislators, and they didn't really seem to have much of a handle on it, and couldn't really speak to it with the knowledge and the passion that I had. And if you don't have health, you don't have anything. Steve Jobs showed us that. And just some heartbreaking stories, and really just got convicted to run and seek an office that we can have some real solutions, and hopefully team up with people like my good buddy Tom when we get up to DC to really right this wrong and really make healthcare about people and not profit, and beholden to individuals and Americans, not stockholders and big business.
No, I completely concur. That's basically a strong part of my introduction. I come to this place a little bit different path, but my father was a doctor. He was a surgeon in the Far East just after World War II, as the Korean War was starting up. They came home to be chief of surgery at a VA hospital. And I used to go with him midnight when he was going out to sew up people from the knife fights. Now you have gunfights, and that's a lot more brutal. Yeah, people survived the knife fights, okay, and got to be friends afterwards. But I knew the travails of our medical system when I was 16, because my father had worked himself to death by that point, because he was the provider of last resort. When no other doctor would come and take care of the patient in the emergency room or treat them in the office, my father always did. He died with $70,000 of unpaid bills, and his bill was $3 for an office visit. That's not the copay. That was the bill.
The bill. Wow.
So this is like 2 or 3 years worth of work that was unpaid. And my mother lived for several years by every time she ran out of money sending bills out to people. And sometimes you got a big bag of pecans, and sometimes you got a chicken. And this was real. This was 50 years ago. So yeah. I've always been aware of the medical condition, but I couldn't imagine emulating my father's dedication. And I missed my father as I was growing up, because he was working so much, and I wanted to make sure I could maybe do a little bit to advance the world while also having time to see my children. So I got a PhD in theoretical physics, and been solving really hard technical problems for 40 years, and it made little difference, because one company's product would be a little bit better than the other companies, and they would get the big profits, and I'd get a pat on the back. This is a lot more rewarding. At age 65, I decided, under the inspiration of Bernie Sanders, that I would start learning whether I was qualified for Congress, I pretty quickly figured out the qualifications are not that outstanding. Judging by the present occupants of many of the seats in Congress. And still I had a lot to learn, and 4 years of 7 days a week, I believe I have learned a lot. I know that when we do Medicare for all, that it will be $1 trillion cheaper than what we're doing now. And that's covering everybody.
Right.
If you left uncovered the people who are presently covered, it'd be 1.6 trillion. Over half the money we spend on healthcare is just load the bucket full of money, give it to somebody. Because those are the laws Congress passes. 1973 HMO Act made for-profit medical care legal in the United States, not legal nowhere else.
Right.
No, there are no countries that have for-profit healthcare system, for-profit health insurance systems. It makes no sense. Think about what happens to a guy who just lost his job and his health insurance this month, and he may get COVID. Who is going to sell him insurance? Right. You can't buy it. It's
right, about to say, and then he can't even buy it. But I'll do you one better. My cousin is a nurse in Atlanta, and she has a friend who works in the same hospital, but she's a contract worker, and she contracted COVID, and she can't even go to the hospital where she was working because the insurance she isn't covered there. So she had to go to pretty much a substandard hospital, and she's not really getting any better. You know, she's in the woods right now. And it's crazy how you can have somebody work at a hospital, they can't be seen.
Well,
you know, or
if you go to a middle-sized town like Gainesville here, the nicest buildings in town are always the medical buildings.
Mm-hmm.
They're rolling in dough. It's our dough. I would rather go in a hospital with linoleum tile on the floor and bare walls and good nurses, because that's how you get well. Having a coffee club down in the basement, in the atrium, doesn't make you well.
Mm-hmm.
Doesn't make me happy. We have to take care of each other, and when we do, we'll come out way ahead. That's what government is supposed to do.
Yeah, and just like you said, I mean, you know, if you just remove the humanity out of it when talking about healthcare, I mean, people who are taken care of, they work longer, they work better, which means they're more productive, which means you get more out of them. I mean, you know, with people, you know, estimated to live, you know, well into their early hundreds in the next, you know, 30 years. And then on top of that, you got Social Security set to run out, you know, it's that 2035. I mean, I have no choice but to work longer.
We'll fix that. You know, the Social Security tax is a flat rate tax, and it cuts off just when it should be starting. So we've been given the wealthy free ride. I mean, Social Security, if you think of it back in around 1789 in France, Social Security really applies to the wealthy. If they take everything, they don't have any Social Security. They lose their heads. And I hate to be rude like that, but we are in a position where people are dying in the streets for the wealth of 600 people in this country. And we need to take the country back. And the best way to do that is by publicly funding elections, clean public funding where you have a voter voucher and I have a voter voucher of $200. That puts a lot of money in every congressional district, and the people who take that money take nothing else. Those people, if you elect them, and you will if they do something good, oh, gee, you know, that's how you get them to pass it. You guarantee them that they're going to be re-elected because they have also passed Medicare for all at the same time. So one makes everybody's life better, and the other allows those happy people to re-elect you. And the lobbyists, if they want to talk to me, and I'm in Congress, which I plan to be right along beside you, they're going to eat a donut when they come to my office, and I'm not going out to dinner with them. If they want to talk to me, they can wait in line behind the people who run the drugstore here in Gainesville or up in Putnam County in Palatka. You know, those are the people I'm representing. I am not representing the corporations. Corporations, I love them so long as they're competing for my money with their goods and services. If it's a monopoly, that ain't capitalism.
No.
No.
And that's one of the things that's a good segue into the pharmacy benefits managers, because you have, you know, 98% of prescription drugs are managed by 3 companies. And those 3 companies not only managing, but they have their own pharmacies, you know what I mean? And they're up underneath the insurance companies, and it's essentially a monopoly. You know, it's that vertical integration that's killing and controlling the entire market. I mean, you got 3 companies controlling 98% of all prescription drugs.
Well, one of the hallmarks, one of the easy things to understand corruption is in the 2004 Medicare Part D bill. Language in that bill says, they don't say it biblically, but I will, thou shalt not negotiate drug prices.
Mm-hmm.
So I worked for government contracting, the DOD at Georgia Tech for 15 years. They worked hard on negotiating everything. And we pay full price, whatever. When they raised the price of EpiPen from $6 to $600, I don't have that long arm. And we have to pay it because the law says we can't negotiate prices. When they extend patent laws and they make patents, oh, we doubled the from 200 to 400 milligram new patent.
Right.
I'm sorry, that ain't a new patent. We're going to take patent laws back and make them rational like they were supposed to be in the Constitution. And now, please give me a summation because I'm eating up.
And that's the no. But I was going to say that's the part that's so important about having the right people in Congress, because all those things are being done, but they don't make the news. You know what I mean? The big things make the news, but stuff like that, by the time we realize it, it's too late. You know, it's been passed already. It's been pushed through, and we have to bear the burden of it. And I really hope that this message can get out to as many people as possible, so they understand. You know, it's not just about voting for president, or it's not just about voting for governor or mayor. You know, the legislative branch has a lot of power and does a lot of work behind the scenes. And by the time we realize that it's too late if it's not been working out.
You can't report on all 100 bills, and when the bill is 800 pages long and nobody has read it by the time they vote on it, and it was written by corporate lawyers, just a real surprise there.
Yeah, and then also just going back to the insurance piece, how, you know, people understanding Medicare for All will force transparency and accountability.
Yes.
And that's something that we don't have right now. And, you know, I give people the example all the time. I say, you ever go to the doctor or to the hospital and you never really know how much they're paying the hospital. You know, you get this big bill from the hospital, but you don't know how much your insurance is paying. Or you start out with, you know, a $3 copay in January, and then by July you're paying $21 for the same drug. You know, and they can just do that. I mean, literally, it may not be a donut hole, it may not be something catastrophic, but it's so much jargon and so much mumbo jumbo in those contracts that you sign. The people who are selling you the insurance can't explain it, because at any given time they can move your drug from a 1 tier to a 3 tier. Or, you know, John Q was a perfect movie for that. You know, he's saying, I've been paying insurance for, you know, 15, 20 years. Now my son needs a heart transplant, and you're telling me it's not covered? I mean, that's a real life issue. And, you know, it's a movie, but I mean, just imagine how many Americans deal with that. I mean, my aunt, for example, has stage 4 cancer. And there's a study going on in the Mayo Clinic, but she can't get there because her insurance does not cover her to go to the Mayo. And this study has proven to be effective in something that's probably going to ultimately be her demise. And with radiation, with chemo, we're basically buying time. So I'm watching my aunt get cooked, get poisoned just to extend her life, and watch her go through all this pain when there's a possible treatment that is proven to be effective, but she can't get there for the simple fact her insurance does not let her go to the Mayo Clinic.
And, you know, we live in a country where Elizabeth Warren was a contract lawyer at Harvard. She
Mhm.
says, I can't read my credit card contract. Imagine trying to read your medical insurance policy. I mean, we have the Medicare Part D says, you need to choose a drug plan. You need to know which drugs you're going to need next year. What? I mean, who can
Right.
make up this kind of stuff?
When most of your patients can't even pronounce the drugs they're taking. They just know it's the one for cholesterol, the one for blood pressure.
Oh, yeah.
And,
No,
and you're expecting people to make decisions.
have we run out of time, Curtis?
Well, yeah, but there's nobody waiting, so.
Oh, okay. So so what do you think about the government's response to the pandemic?
Man, I mean, if again, you know, being a football player, I related to being in the huddle with a minute 30 left, and you know, it's a pressure cooker. So you got some people that'll rise to the occasion, some people that'll sink, and it just shows how inadequate the leadership in Washington is at a time like this. You know what I mean? You were ill prepared.
They're busy complaining about China.
Right.
Where in February, when they could have done something about it, they were bragging about how great China was.
Right.
And
that's across the board. I mean, it's you were ill prepared for it, and now you're trying to play catch up. In the medical world, you cannot beat time. When studies have to be done, when you know other things put in place to know what drug is going to be effective, what therapy is going to be effective, you cannot replace time. And in a crunch, you had no time. So the social distancing was just to buy them some more time. Everything has just been to buy them some more time. Well, and you know, hide their inadequacies.
They did testing, but they did no tracking or containment. So the closure put people out of business, devastated the economy, and did nothing to slow down the epidemic at all.
No, I mean, and they just kept trying to
and just take off like a rocket.
Just kept trying to buy time. And now, you know, when you talk to somebody who had made suggestions about Medicare for all, now you're saying everybody should go get tested. That's pretty much Medicare for all. You know what I mean? If free testing, if we would have did this, if we would have had this before, where would we be now? Another thing when they talking about, you know, this stimulus that didn't stimulate anything, because, you know, people had to pay their bills. You know, that $1,200 is not a stimulus. I mean, that's the joke. Again, you're just putting up this facade and make yourself look good to people that are
to the big pipe carrying $1 million per second to these guys. That would amount in a week to about $2,000 per person for every man, woman, child, incarcerated person, everybody in the whole country. And that's just to bail out a few dozen companies who spent the last $1 trillion we gave them buying up their own stock.
Right. Again, lack of oversight is something that we always.
Trump has gone and fired the inspector generals, which were assigned by the House and Senate to do oversight of the last relief bill. It's insane. It's insane. And people are still defending Trump. I mean, I can understand people making a mistake, but
I can't understand it anymore. I can't give them a pass anymore.
No, I think it's a decreasing number, which we'll find out when we have an election, if we actually have an election. I mean, we're at the state where the violations of the Constitution are daily.
Right. And see, and then another thing too, you have every 10 years you have that magical census. And with everything, all these distractions, I'm not only telling people to be safe and to build their immune system for the COVID, but I'm stressing and overstressing, fill out and complete the census. If somebody asks me, well, what do you want to do about juvenile justice? What are your plans about, you know, after school programs? I say, well, have you filled out your census? Well, no, I haven't. I say, well, that's number one. Because before we can do anything, we need you to fill out that census so we can make sure those dollars can be, we can bring those dollars back to the
district. That's one of the most important things you can do for your congressional district relative to others. Now, I want us all to prosper, but I don't mind if District 3 and District, is it
5.
5. Do especially well.
Right, because that's the object of the game. Because we saw how they say, well, how can you pay for Medicare for? How can you pay for student loan forgiveness?
It pays us. It's so much cheaper than what we're doing. Like the corporate gifting program in this country is unparalleled in the world. I mean, Putin takes better care of the people in Russia than we're getting from our government, because Putin is a single dictator. And if the people start getting stressed out, they know who to come and talk to. But we got 600 different corporations. If any one of them starts acting normal, like something less than total homicidal greed, the others pull up the slack, and we suffer more every year than the year before.
Yeah.
And we're being taught by the media, which happens to be owned by the super rich people who are getting all that graft and corruption, that is somebody else. I'm sure it's you. You're the one at fault. You probably think it's me. Supposed to. But yeah, neither one of us has fallen for that. And I don't think very many people need anything but to hear the truth.
Yeah. And that's what, just hopefully, the message can get out to everybody, because I don't know how it is in your district, but I mean, we have, probably a 20% turnout, to vote. And I mean, that's ridiculous.
We're going to have more people voting this year.
I really hope so. And I think we would definitely have more people with the pandemic, if they can figure out how to kind of, do something. Do something. But I think a lot of people are going to be itching to vote and let their voices be heard, because we're in a situation we could never imagine.
We have little to do with the conditions presently. The devastation is just starting, I fear.
Yeah.
It's dismaying. Dismaying. Albert, it has been so very good to share a few minutes of your time. I very much appreciate your showing up and chatting. Very enjoyable.
Yeah, anytime. It's always good to talk to sensible, like-minded people like yourself. And maybe if you grow a little bit of that, they might think we're twins or something.
Yeah. No, I take my Martin Luther King dead serious. He says, we'll learn to live together as brothers, or we will all die together as fools. And we're rushing towards that dying together as fools. And we are not living together as brothers. We're treating the whole world as a combat zone.
Right.
Everybody else is at fault and we're perfect. You cannot solve the problems that you do not know or exist, that you do not acknowledge.
I couldn't have put it better myself.
You've been putting things well all evening. Really enjoyed chatting with you.
Hey, well, it was great talking with you. Appreciate it, Curtis.
Hey, thanks, Albert. Nice to meet you too, sir. And we'll be in touch if I'll get you a copy of this.
Okay. Sounds great.
Okay.
Have a good night.
Yep.
Good night, sir.